So before, telehealth was only allowed in rural areas. So only certain doctors could provide that for their patients and thus bill as if they were seeing a patient in person. There was an emergent law that was passed back in March that allowed physicians, it was late March actually, that allowed physicians to anywhere do telehealth to continue to provide care to those patients, because we're telling patients to stay home, but yet we have all these chronic diseases that are outside of COVID or coronavirus that still need to be taken care of. And patients weren't going to the hospital, or they weren't seeing their doctors, or they weren't getting immunizations that were needed. And so all these other diseases don't go away. Telehealth has allowed us to still be able to provide that care for the patient, but keep them safe and keep them at home, especially if they're at risk. That law I did look into, it has been extended right now to September 30th for everyone across the board. Whatever Medicare and CMS does, that's usually what the other private insurances do. So like Blue Cross and United Healthcare, all of those are following suit. Our hope as physicians is that it really has changed how we're able to help, again, those elderly patients who have transportation problems or mobility problems, to not be able to get into their doctor, but yet still get their care. Because again, health at home is only one person. They've got a limited number of people, limited number of patients they can provide care for adequately. It's great if the physician can also do that from home. So we're hoping that gets extended and really changes healthcare moving forward forever.
Is your professional opinion, clearly stating opinion, that telehealth will extend and move forward majorly because of this pandemic? I mean, that it's going to see huge changes?
Again, I think it's a hope for us. We're not confident that it will completely do, because it is a cost issue with Medicare, and they've been cutting Medicare costs and payments for years. So this would increase their cost, though it does improve quality of care and access to care. I'm not sure what the government will do about that, unfortunately.